to find a location. And now I know the lines have gotten very long in some states. That's why I ordered FEMA to set up pop-up sites in places with high demand to shorten the wait. We stood up 6 new sites in New York City in 5 days, and there are more coming. For over-the-counter at-home tests, as I said, there were none when we took office, none. Now we have 8 on the market, and just 3 days ago, another test was cleared. We went from no over-the-counter tests in January to 46 million in October, 100 million in November, and almost 200 million in December. But it's not enough. It's clearly not enough. If we'd known, we would have gone harder, quicker if we could have. Because steps we have to take to increase the number of authorized tests, we're now able to purchase 500 million at-home rapid tests to be sent to the American people for free when they request it. And we're going to continue to use the Defense Production Act to produce as many tests as possible. And starting in 2 weeks, private insurance will reimburse you for the cost of at-home tests. We're providing access to free tests for folks who don't have insurance. But we have to do more. We have to do better, and we will. The third point I'd like to make is more support for your hospitals. On hospitalizations, let me start with this. Because we have had so many vaccinated and boosted, we're not seeing hospitalizations rise as sharply as we did in March of 2020, or even this past fall. America had made progress. Things are better. But we do know that with the rising cases, we still have tens of millions of unvaccinated people, and we're seeing hospitalizations rise. It means our hospitals in some places are going to get overrun, but in terms of equipment, both in terms of equipment and staff. That's why we stockpiled and pre-positioned millions of gowns, gloves, masks, and ventilators. We're mobilizing an additional 1,000 military doctors and nurses and medics to help staff hospitals. FEMA is deploying hundreds of ambulances and EMS crews to transport patients. We've already deployed emergency response teams in Colorado, Michigan, Minnesota, Vermont, New Hampshire, and New Mexico. We're ready to provide more hospital beds as well. The bottom line is we want to assure the American people that we're prepared. We know what it takes. And as this group of bipartisan governors has shown, we're going to get through it by working together. I want to thank the governors for their partnership, and I mean that sincerely. With that, I'm going to turn it back over to Jeff, and I understand you guys may have some questions. Jeff?